I am honored and pleased this morning to address you at this 6th Quadrennial Health Conference upon the 80th anniversary of the Trinidad and Tobago Registered Nurses Association. As you would appreciate, this is also a very special moment for me on a personal level because it is the first time I am making a formal address as the newly appointed Minister of Health. I am particularly pleased that this, my first formal address, should be made to you, our nation's nurses. You are the first contact our clients, the patients, make with our healthcare system. Yours is a particularly critical responsibility, and I will return to this shortly. Let me first of all, however, take this opportunity to express my gratitude to our Prime Minister, the Honorable Kamala Persad-Bissessar, my former student, for bestowing upon me the trust to serve the people of Trinidad and Tobago in this capacity. I will do everything in my power to rise to the expectations of the citizenry in this regard and strive to meet our nation's health needs, demands, and desires. Further, I wish to acknowledge the historic significance of this recent election, which has given our nation its first female Prime Minister, its first recent female health minister, and as a result, a cabinet that is truly reflective of multiculturalism and respect for every creed, race, religion, and socio-economic background as promised by our new government. I would also like to begin by congratulating the Trinidad and Tobago Registered Nurses Association for their 80 years of continuous and invaluable contribution to the advancement of healthcare, particularly in nursing care in Trinidad and Tobago. International Nurses Day was commemorated on May 12, 2010. So let me at this point warmly wish all nurses gathered here, at home, and in our nation's hospitals and health centers, because some have to work today, a belated Happy International Nurses Day. Ladies and gentlemen, the value of our nurses cannot be underscored. Our public health system currently employs 6,427 nurses in Trinidad and Tobago. These women and men make invaluable contributions to the delivery of healthcare in our country every day. It is a job that is often faced with few words of appreciation or tokens of gratitude. And I wish to very sincerely and publicly thank you on behalf of the Honorable Prime Minister Kamala Persad-Bissessar, your new government, the Ministry of Health, and the people of Trinidad and Tobago. As you may know, the theme for International Nurses Day 2010 was Delivering Quality, Serving Communities, Nurses Leading Chronic Care. This theme is quite relevant to us here in Trinidad and Tobago and to the Ministry of Health's focus on the reduction of non-communicable diseases in our population. The Ministry's health and wellness initiatives and promotion of primary health care will be geared towards the prevention of non-communicable diseases across the population, also tackling the growing problems of obesity and HIV/AIDS, with even greater emphasis to be placed on prevention and promotion of healthy lifestyles utilizing sport. And I noticed that it was mentioned in the newspapers that one of my siblings is the fearless one. So he asked me yesterday if I was the fearless too. Nutrition and exercise. Today's conference theme, Nursing Leadership, the cornerstone of nursing best practice in the 21st century, really hits the nail on the head. Our nurses are ideally positioned to lead this fight against these diseases. Nurses are the first category of medical staff that patients, our clients, see when they are admitted to health facilities. You are well positioned to provide creative and innovative solutions to the challenge of chronic conditions and to make a real difference to the day-to-day lives of patients, families, and the greater communities. As you discuss this theme throughout the week, I would like to commend for your consideration some thoughts I recently read following a seminar hosted at the Abu Dhabi Men's College. The speakers indicated that what was really one way to lead, there was only one way, and that is by example. An opinion shared by our Honorable Prime Minister Kamala Persad-Bissessar. If we are to set the example that we want followed, it was argued that there were 3 levels of awareness that we need. And now my students watching this will say, she's going to lecture. First, self-awareness. Awareness of your own thoughts and attitudes. Secondly, we need to be aware of others, their concerns and their attitudes. And thirdly, we need to be aware of what is happening around us in the world at large, and in Trinidad and Tobago in particular. Primary health care and health promotion are 2 of the key strategies through which the Ministry of Health plans to achieve our vision for health. Primary health care is preventative in that persons are encouraged to develop closer relationships with their healthcare providers to detect and treat emergent problems before they develop into non-communicable diseases. This is but one area in which nurses are critical to the success of the Ministry of Health thrust towards effective and efficient primary healthcare services. You have the opportunity to develop long-lasting relationships with the patients in the communities that you serve. You have the influence to empower them with the education and information that they need to make healthy lifestyle choices as they meet you in the health centers or when you go out and visit their homes, their schools, and their communities. There is an urgent need for nurses everywhere to take this initiative and engage with all parts of the community and all sectors to address the growing threat that these diseases pose to our nation's health and well-being. However, it is acknowledged that to be effective, nurses must possess the education, skills, and resources required to provide good health care. My dear colleagues, and I refer to you as colleagues because I believe we are all partners in our quest to brand the Ministry of Health as the most performing ministry in Trinidad and Tobago. The Ministry of Health is committed to supporting the advancement of the nursing profession through training and education. I wish to encourage you all here today to continue to benefit from the various educational opportunities that are currently available, as well as the opportunities we shall be increasingly creating for you.